My name is David Tate, and this is a video for my vulnerable population simulation assignment. The situation presented was a homeless young single mother who was getting ready for discharge with a newborn. The patient has a history of drug use and did not have family present or a ride for discharge. The role I would have played is a mother-baby nurse who was responsible for teaching self-care as well as infant care in a caring environment. I would need to exercise problem solving skills and be open minded and manage my biases to provide culturally competent care and education that empower the young mother. I have not experienced this specific scenario. However, as a PACU nurse, discharging patients after surgery, I have encountered similar patients who are homeless and don't have family present or have the financial means to obtain needed medications and assistance after discharge. Initially, I noticed the care provider was rushed and not genuine. She would pause quietly after the patient voiced a complication or concern and not address the problem. The nurse later did show frustration and concern for the patient and baby's safety, but felt she was powerless with the need to discharge the patient to make room for new patients and keep the patient flow going. This happens all too often in the PACU, where patients continue to flow out of the OR, and we have to make room for them in the PACU area. When answering the debriefing guide questions, question number one, where I saw caring exhibited, uh, that was done with Nancy, who was conducting education on diaper changes and cord care. I think she did talk to her coworker with her frustration, seeking advice, which did recognize that she had concerns and was trying to address them. She also recognized the needs of the mother, but didn't really follow through with actions. Nancy did ask if Becca had any questions, as well as acknowledge the baby's cuteness when the patient had mentioned it. As far as question two with behaviors that were not caring, there were several of them that I noticed. One of them being cutting the patient off as she was answering her questions, even when she was identifying the patient, and other times then she answered questions and then would talk over her. Also, not addressing the patient's needs for shelter and safety when they were brought up. She just glazed over that. She also didn't really listen and take time to sit with the patient and try to address her concerns. And she was telling the patient it's getting really busy and she wanted to hurry up and discharge the patient, and which would have been a barrier for the patient to be receptive to any kind of other instructions. And she would also refer to the baby as the baby instead of by the patient's name, the baby's name, by having asked Becca if she had named the child. And she was also short and abrupt with Becca. As far as question three, in the scenario, what I would have done is approach the situation openly, start off with aid it, and also Nancy did perform some of the steps of aid it, but didn't really complete them all. I would try to build that rapport, and when concerns were brought up about being homeless and medication for pain management, I would pause and sit at the bed or at Becca's level and ask for more details and reassure her that there are resources available. I would follow up with her concerns before coming back to complete the discharge process. For example, discussing the case with the case manager slash social worker, who should also already be aware of the disposition. I would also provide education on pain management and encourage her to eat prior to taking a Motrin, as well as educate her on the benefits of Motrin over Percocet. And have Becca perform return demonstration to verify she understood and would be capable of managing herself as well as her newborn baby. And if there were further concerns for safety of the baby, I would escalate it to a social worker who would work with the child enforcement agency for the baby's safety. In question four, as far as priorities for the patient, Becca, She needed a place to stay and safety for herself and her baby, and she displayed a priority of hers was pain medication management and knowledge deficit of child care. As far as for the nursing priorities, her priorities were to push through the discharge process so there wasn't a delay. Other priorities were safety of the baby and patient providing basic care needs for the infant, and finding a support system for the mother and infant. As a nurse, I would not hesitate getting a case manager and social worker involved right away. Question 5 resources, which leads to resources available, are, like I said, a case manager and social worker. They would ensure Becca was enrolled in community programs like WIC, wellness clinics, a shelter for women and children, perhaps a church organization that provides to the vulnerable and underserved. Other resources would be a mental health counseling and support center to help with substance abuse and coping with life problems and potential depression. That would be a very important thing. And then, as far as how I would transfer what I learned to the practical setting, is by being open and accepting of each patient with their unique life experience, and be a servant leader and place their needs first while providing genuine and compassionate care. Thank you for watching this video.